Morning to all. Today we are going to discuss about Angitis Obliterans. Angitis Obliterans is a rare disease of the arteries and veins, the arms and legs. It is otherwise called as Buerger's disease. Angitis Obliterans is a disease in which the blood vessels become inflamed, swell and can become blocked with blood clots. It is differentiated from other vessel disease by its microscopic appearance. In contrast to atherosclerosis, Buerger's disease is believed to be an autoimmune disease that results in occlusion of distal vessels. It is also called as presenile gangrene. So here we can see the diagrammatic representation of this particular disease. Incidence, it occurs most often in men between the ages of 20 and 30 years, and it has been reported in all races and in many areas of the world. Etiology or causes. The cause of Buerger's disease is unknown, but it is believed to be an autoimmune vasculitis. Vasculitis means inflammation of the blood vessel. Other causes are genetic predisposition. There is considerable evidence that heavy smoking or chewing of tobacco is a causative or an aggravating factor. Generally, the lower extremities are affected, but arteries in the upper extremities or viscera can also be involved. Buerger's disease is generally bilateral and symmetric with focal lesions. Next, we can see the risk factors. The common risk factors are tobacco use, chronic gum disease. The pathophysiology of this particular disease is due to the etiological factors. Acute inflammation and thrombosis of the veins used to occur in the hands and feet, which may lead to vasculitis, that means inflammation of the blood vessel, that leads to decreased blood supply to the skin and the gangrene forms. Clinical manifestations of Buerger's disease are pain is the most important clinical manifestation. Then the patient complains of foot cramps, especially of the arch after exercise. A burning pain is aggravated by emotional disturbance, nicotine and chilling. Cold sensitivity of the Raynaud type is found in one half of the patients. Digital rest pain is constant and the characteristics of the pain do not change between activity and rest. The physical signs include intense rubor of the foot, absence of the pedal pulse, radial and ulnar artery pulses are absent. Various types of paresthesia may develop. As the disease progresses, definite redness or cyanosis of the part appears when the extremity is in a dependent position. Involvement is generally bilateral, but color changes may affect only extremity or other certain digits. Color changes may progress to ulceration, and ulceration with gangrene eventually occurs. Next, we can see the diagnostic measures. History taking, physical examination, which may helps to identify the ischemia, claudication, pain at rest, segmental limb blood pressure, then duplex ultrasonography in order to document the patency of the proximal vessels and to visualize the extent of distal disease. Contrast angiography is done to demonstrate the diseased portion of the anatomy. Then distal phlebotomography. The main objectives of management is to improve circulation to the extremity, to prevent the progression of the disease and to protect the extremity from trauma and infection. Management involves treatment of ulceration and gangrene is directed toward minimizing infection. Then tobacco use is highly detrimental and patients are strongly advised to stop using tobacco completely. Vasodilators, then prostaglandins like limaprost, which relieve pain. A regional sympathetic block or gangliectomy may be useful in some instances to produce vasodilation, which helps to increase blood flow to the limb. Debridement is done in case of necrotic ulcers. In chronic cases, lumbar sympathectomy is done to reduce vasoconstriction and increase the blood flow to limb. Above knee and below knee amputation is done in rare cases. Anti-inflammatory drugs like corticosteroids are used for inflammation and pain. Bypass can also be done in some cases. Nursing management, if amputation is performed, We should elevate the stump for the first 24 hours to promote venous return and minimize edema, and the incision is monitored for the signs of hematoma. The patient may experience grief, fear, or anxiety related to loss of the limb. Patient is encouraged to discuss his or her feelings. Spiritual advisors and other healthcare team members are consulted as appropriate. Recovery and rehabilitation require consultation among healthcare providers. The patient is assisted in developing a plan to stop using tobacco and manage pain. Patient may need to encourage to make the lifestyle changes necessary with the chronic disease, including lifestyle modifications like diet, activity, and hygienic care. The nurse determines whether the patient has a network of family and helps to assist with the activities of daily living. Nurse ensures patient has knowledge and ability to assess for any post-operative complications such as infection and decreased blood flow. So far we have discussed definition of Buerger's disease, etiological factors, risk factors, then pathophysiology, clinical manifestation, diagnostic evaluations, medical management, and nursing management. Hope you all understood. Thank you so much.